Hello everyone, I'm Danely Lopez and this is my Capstone presentation, an assessment of personalized communications to improve adolescents' experiences at Wyckoff Heights Pediatric Medical Center. The purpose of this project was to help evaluate Wyckoff's current text messaging software and help assess if it is helping to improve and maintain adolescents in treatment with PrEP and other clinical services. Data was collected in survey forms. 2 surveys were done. One was during the client's intake appointment, and a second one was done 6 weeks after. The survey helped gauge participants' feedback on the effectiveness of the text messaging as a personalized communication strategy. It also helped make improvements to the existing service already put in place. Now to give a little background on Wyckoff Medical Center. Wyckoff's PrEP and adolescent program began in support of Mayor Bill de Blasio's Ending the Epidemic Plan and First Lady NYC Unity Project. They service young people ages 13 to 24 years old with any HIV preventative services. Some of those services are PrEP and PEP, HIV testing, STI testing, along with health education workshops and birth control options. Before this program evaluation began, a retrospective study was conducted by the program manager at Wyckoff. In this meeting, the program manager presented a compelling argument to key stakeholders as to why the PrEP program had to begin incorporating text messages as a tool to improve communication with clients. This meeting was a success, and the PrEP program was awarded a grant of $7,000 to purchase the SMS software. And like I said before, two surveys were conducted as part of the methods section. One of them was done at the intake and another 6 weeks after to get feedback on the software. Despite launching and implementing this new form of communication in the middle of a global pandemic, the results were overwhelmingly positive. 55 individuals were reached by the text message system between April 2020 to October 2020. 38 out of the 55 individuals returned for their follow-up appointments due to the text message reminders 6 weeks after. 78 expressed that they would use a text message system again in the future if made available. And Wyckoff saw a 15% increase in its adolescent participation rate. Other additional findings to take note of are that when asked to rate the text message reminder software on a scale of 1 to 5, 1 being unsatisfied and 5 being very satisfied, clients were leaning towards the high numbers of 4 and 5 on this scale. And to top it off, 84% of the clients found that the text messaging content was very useful. Some limitations seen in this project were delays in the implementation process due to COVID-19. Originally, this project was intended to be done in person, meaning that the surveys were to be completed in person with a staff member to assist with any questions and concerns the client might have and get live data. Due to COVID, things had to transition into remote work. This meant that in-person surveys were now a Google form link, which sometimes were not sent or received on time. In the transition from in-person to remote, some data entry errors were made when staff was inputting data from a paper-based system to an online software. Lastly, with any mHealth tool, there's always a worry of a breach in confidentiality. This was not a major setback, as staff were told to mention this information to the clients before their enrollment. Based on the evaluation of the SMS system initiative at Wyckoff, I recommend the following, with the assumption that there will be further evaluations and implementation in the future. The first recommendation is to consider training all staff involved in the prep program to avoid losing trained individuals and have to pay for the retraining of staff by the company. Consider additional staffing to double-check and insert data from the paper-based system to the text messaging software to avoid additional errors and costs. Ensure someone at Wyckoff is trained to fix minor tech problems if presented to keep a sustainable system. Utilize a budget tracking template to track mHealth expenditures moving forward in order to present to stakeholders when applying for monetary grants in the future. And lastly, any future reports involve reasons why patients are defaulting from care. This would allow for important information to be collected that would help guide future interventions and eventually improve retention. In conclusion, the use of text messaging reminders had a positive response from both clients and health facility staff. The extensive body of literature on this topic highlights that text messaging reminders provide an inexpensive, easily implemented, and automated method to improve appointment attendance. Within the months of launching and implementing this project, Wyckoff's no-show rate dropped significantly, thus improving clients' return rates and appointment attendance. Finally, I would like to thank the prep program at Wyckoff for allowing me to come into their space and conducting this evaluation. I would like to specifically thank the program manager, Christopher Vargas, and his incredible staff for their assistance in coordinating and reviewing this report, along with the CUNY Graduate School of Public Health Capstone advisors, Dr. Stacy Pilich and Dr. Charles Kane, for their valuable feedback. Thank you all for listening.